there are some discrepancy in the guidelines. If we see the American guideline, you will see the target is different. If you see the European guideline, the target again changes. So as per the European Society of Cardiology current guideline, anybody who has high risk cardiovascular disease, their LDL cholesterol has to be less than at least 55. If you see the American guideline, ACC guideline, they are little relaxed. As of now, they do mention that LDL lowering is good for the patient, lower is better. But as of now, the target which they mention, they do not say anything less than 70. So 70 is definitely a target as per the American guideline, but they do not mention how low should we go. Contrary to our expert opinion, our CSI Cardiological Society of India recommendation, and as per our clinical experience as well, probably we cannot replicate the Western guideline of lipid target for our population because of the fact that our patient, they do develop the atherosclerotic cardiovascular disease earlier, around 10 years earlier than the Western counterpart, and we develop this disease at a lower level of LDL. So probably our target LDL should be more stringent. So as per the Lipid Association of India, this is one of the expert consensus. This is not actually a recommendation because this is not a guideline, but this is expert consensus which suggests that anybody with extreme CV risk, the high CV risk, the LDL target should be less than 50, which we all accept actually. We all cardiovascular interventionists, we accept that anybody who has developed ASCVD or having multiple risk factor or very high risk for future ASCVD, LDL target definitely should be less than 50. Now, there are a group of patients who are considered extreme CV risk, very high risk. So they have different category as per the LI recommendation. But what we see, anybody who has recurrent event, in spite of proper cholesterol management treatment, or there is family history of premature atherosclerotic cardiovascular death, there the target should be very stringent, at least less than 30, and there is a optional target of reaching below 20, even 10-15 milligram of LDL. So that is the overall consensus. In fact, we do follow this in our day-to-day practice. Fine. We can go to next slides. So these are, concern if we actually reach that low level of LDL cholesterol. Is there any problem? Is it going to give rise to different side effect or adverse reaction? To be very honest, all the doubts regarding the side effects with extreme low level of LDL are actually now out because multiple meta-analysis has clearly shown mostly the issue where chances of higher hemorrhagic stroke, cataract formation, neurological side effects, say for example dementia, those are actually not seen. The meta-analysis has clearly shown they are actually myth, they are not practical things. And you will be surprised to know that this apolipoprotein, which is very much responsible for transport of this cholesterol, mostly LDL cholesterol, they do not actually cross the blood-brain barrier. So all the issue of neurological side effect, hemorrhagic stroke, and dementia, they are actually impractical because, to be very honest, the homeostasis of cholesterol metabolism inside this central nervous system is independent. It is not dependent on the circulating level of cholesterol. And very honest, to be very honest, all the unit of our body, that is the cells, they have their indigenous mechanism of synthesizing cholesterol. So they are not actually dependent on the blood circulation cholesterol level. So all the possible side effects, they are actually now excluded. So we actually should reach, whenever indicated, to a very low level of LDL cholesterol. There are some ethnicity in the world, say for example, people like Eskimos and other congenital mutation where the LDL cholesterol is naturally very low, and they had been followed up for long. and they were found to have no side effect, no adverse reaction, but very lesser number of cardiovascular events, and as a result their survival is prolonged. So all the problem of reaching very low LDL cholesterol are actually not considered practical.